recommendation have been implemented recently in RevMan, available for authors of systematic review and meta-analysis. So this presentation is largely based on the webinar that has been published on the Cochrane Method Group website, on Cochrane Training, and also on YouTube, thanks to Professor Joe Mackenzie and Professor Guelimi. And this presentation has also been based on the details that have been updated in the Cochrane Handbook for Systematic Reviews of Intervention that anyone can access. So let's have an overview of the recent recommendation and the new implementation in RevMan. So this is an overview of the recommendation, and we will, in this presentation, focus on several aspects: the estimation of tau square, the estimation of its confidence interval, and then the estimation of the confidence interval of the summary mean, and also the prediction interval for the summary mean. And we're going to start with the estimation of tau square. So before 2024, the only method available in RevMan for the estimation of tau square was the Simonian and Laird method. But this method has shown that it frequently underestimates tau square, especially in the context of few studies, which is generally the case in a majority of Cochrane reviews. Recently, a new method has been implemented, the restricted maximum likelihood, which performs better than the Simonian and Laird method and provides less biased estimates, regardless of the number of studies. So here we have an example where we have the tau square estimation using the Simonian and Laird method, and also the tau square estimation using the restricted maximum likelihood method. And here, the restricted maximum likelihood method has a higher value of tau square, which reflects better the heterogeneity of the meta-analysis. Even though we can estimate tau square, those estimates can be imprecise, which is why now in RevMan it is possible to also estimate the confidence interval of tau square. This is especially useful for authors because it conveys the uncertainty in the estimate and also provides an indication as to whether there truly is heterogeneity or not. For example, here we see that the 95% confidence interval for tau square, the between study heterogeneity, exclude the value of 0, which means that we are indeed in the presence of statistical heterogeneity. Now, let's look at the different methods that are used for the estimation of the confidence interval and the prediction interval. Various methods are available to calculate the confidence interval of the summary measure. Until 2024, only one method was available in RevMan, and it was the wild-type confidence interval method with a normal standard distribution. However, it has been shown in simulation study that this method can yield overly narrow confidence interval when few studies are included. And several alternative methods have been tested in simulation study, and most notable among the alternative methods is the Hartung-Knapp-Seeling-Junkman method. With the Hartung-Knapp-Seeling Junkman method, the adjustment using this method widens the confidence interval to reflect the uncertainty in the estimation of the between-study heterogeneity, tau square. And this method performs well in the presence of observed heterogeneity. And we can see here in this example, for example, the two methods, the wild-type method and the Hartung-Knapp-Seeling-Junkman method, with the second one providing wider confidence interval compared to the previous one. However, the Hartung-Knapp-Seeling-Junkman method shows some limitation. For example, when no heterogeneity is observed, that means tau square equals 0, the Hartung-Knapp-Seeling-Junkman method can yield overly narrow confidence interval compared to the other method. And we can see here in the example on the top of the slide. Another limitation is that when there are few studies, the Hartung-Knapp-Seeling-Junkman method can yield overly wide confidence interval, which is the opposite of the previous limitation. And we can see this in the two examples on the bottom of the slide with really wide confidence intervals. This has led the Cochrane statistical group to emit some recommendation regarding the tau estimation. So for now, the method used for tau estimation in RevMan remains the wild-type method. But authors are prompted to use the Hartung-Knapp-Seeling-Junkman method when the between-study heterogeneity is greater than 0, that means the tau square is different than 0, and when the number of study is more than 2. And with this recommendation, This reduces the risk of producing overly narrow confidence intervals or overly wide confidence interval, which is the protocol that authors are prompted to use when conducting a meta-analysis in RevMan. One other feature of RevMan that has been implemented recently is the capacity to estimate prediction interval for the summary mean. We remind that prediction interval is defined as the interval within which we expect that the effect of a future study will lie. And the summary, and in other words, this is the summary of the spread of the underlying effects in the studies included in the meta-analysis. So this follows the recommendation based on what method has been used at the previous step, which means that the authors must follow the method that was used for the confidence interval estimation, either the wild-type confidence interval method or the Artung-Knapp-Siding-Jonkman method. Overall, those new methods implemented in RevMan for random effect model meta-analysis are based on simulation studies and based on empirical findings. This has led the Cochrane Statistical Method Group to emit new recommendations that have been implemented in RevMan. And we can also see that these new recommendations are now updated in the Cochrane Handbook at the section dedicated in the meta-analysis with random effect model. And what we need to remember is either for the tau estimation, now the default method is the restricted maximum likelihood method. But authors can still choose to use the Dar-Simon and Laird method if they want to, but this is optional. And then for the estimation of the confidence interval for the summary effect, now the Artung-Knapp-Siding-Jonkman method is recommended, but only if there is heterogeneity, which means tau square is above 0, and if the number of studies is above 2. Furthermore, RevMan now makes it possible to estimate the prediction interval using similar methods as the one used for the estimation of the confidence interval. And of course, I would encourage anyone interested in those methods to go have a look at the Cochrane training video, which are available on the Cochrane website or on YouTube. And also, for more details, go on the Cochrane Handbook for a more detailed explanation. Thank you very much.
Thank you, Robin, for your presentation, and thank you both of you for these updates. So to date, AI is a little bit disappointed, except for extraction
screening.
And maybe screening,
yeah.
Yes. And I was wondering how the author deals for the extraction between different sources. For the psoriasis review, we extract the outcomes using the publication, but also clinical trial data. And so how they deal with these different sources, and maybe the discrepancy between these sources.
Yeah. In the study that I presented, they just take 10 studies. Convenience sample. They choose studies where there is a PDF available.
Okay,
so
only the published study.
Only the published study.
I think you could deal with that with the prompt, but it adds a new difficulty to the extraction to give it a ranking. Between the different sources, I think, and maybe in a few. Few weeks, years, it will be ready
Maybe
to use.
System, the LMS, a software system for systematic review to extract and screen, and I don't know.
In Covidence, right now you have the choice to start your selection using a AI tool that excluded directly all the non-randomized control trials or references that did not refer to a randomized control trial. And I use it for the first time for a review ongoing on intervention for topical treatment for psoriasis that is now ongoing in collaboration with Aaron Drucker, and I check all the excluded references, and I didn't find any mistake.
Using Covidence.
Using Covidence.
Not another
Yes,
AI
using
tool.
Covidence.
Okay.
Well, it's useful because he on about 10,000 references, he directly select and
excluded
yes 3,000. So it's quite interesting.
I don't know if some people who are connected have experience with AI, but yes, you have a first experience with that, but only with a partial.
Yes, just excluding references that are obviously not
randomized commentary, editorial, something like that. Yeah.
But things are going really, really fast. And if you are interested in that topic, Cochrane have done this year 6 webinars that are available freely on the Cochrane website, and for each step and also for writing discussion, they present more in details the different studies that have been done on that topic.
And a question for Robin. Can you confirm that for the new methods, you need to use it if you have heterogeneity and at least 2 studies? That's right.
Yes.
If not, you use the wild method.
Yeah, the default method remains the wild type method, which is the one that was previously implemented in RevMan. And now the new method should be used only in the presence of heterogeneity, and if there is more than 2 studies, which means at least 3 studies included in the meta-analysis. And authors need to make this change themselves. This will not be automatic. Sometimes there is a warning message that is put in RevMan saying maybe you can try to use the other method, but it's something that the authors need to do themselves.
Okay, thank you very much.